Okay, H. pylori, Heliobacter pylori. Now, there are some healthcare professionals that believe an infection with a type of bacteria called H. pylori can cause an ulcer to occur. And there are some recent studies, however, that have suggested that the overgrowth of the bacteria in the stomach may only be the result of the ulcer and not the cause. And the reason why they think that is because the H. pylori can produce a chemical substance like its own antibiotic that appears to protect the GI tract against pathogens. And they produce something called urease, which converts urea to ammonia and neutralizes the acidity of the stomach. So, what they typically do if someone has H. pylori is they go, well, you have H. pylori and you have an ulcer. The H. pylori is causing the ulcer, right? It's like saying every fire that I've been to, there's always firemen. Those firemen have to be causing the fire, right? It sounds silly. So there's an association. I don't know if there's causation. And this is some of the discrepancy today with H. pylori because the main treatment for it is just to give antibiotics to kill the H. pylori. Now, patients experience pain as the most common clinical symptom when they have a gastric ulcer. And the pain usually occurs when the patient's hungry and the stomach is empty. Okay, and that's different than a duodenal ulcer. Okay, with a stomach ulcer, the pain is when they're hungry and there's nothing in the stomach. You have all that acidity there, so they have this sharp, this burning type of pain. It's located in the stomach, in the abdomen, and in the back. And if they ingest something, just something small, a little bit bland, okay, many times that can relieve some of the stomach pain from the stomach ulcer temporarily. Stomach ulcers, they are more severe than duodenal ulcers, and patients usually experience more hematemesis. Remember, that's the vomiting of blood that looks like coffee grind, gastroesophageal reflux disease, anorexia, and weight loss with gastric ulcers. So when you look at the linings, the innermost lining is the mucosa. Okay, then you have a muscularis mucosa, then you have a submucosa, then you have another muscular layer, and then you have the outer layer, which is the serosa. So it becomes more painful, obviously, the deeper it gets. Okay. But this mucosal lining, this is such an important layer. That's the what prostaglandins are involved in producing these mucosal cells to produce mucus to protect it from this type of ulcer. So here's an esophageal ulcer, here's a gastric ulcer, and here's a duodenal ulcer. And this is what it looks like if you were to zoom in on it. These are gastric ulcers. And when a person has the gastric ulcer, the first thing is we have to reduce the stress. You have to reduce all the causes of the cancer of the esophagus. And what seems to be pretty helpful is cabbage juice and even carrot juice. They contain this chemical that's known as substance U. They call it substance U because it's been shown to help facilitate the healing of ulcers. What we know now is that these juices are pretty high in glutamine. And glutamine, remember, that was one of the important things where I said if you had intestinal permeability or leaky gut, glutamine is very, very healing to the epithelial cells. Aloe vera juice, very helpful. Deglycerized licorice, excellent, very helpful. Just have to be careful with certain people that are sensitive. It can create headaches. You have to be careful with that and can sometimes raise blood pressure. So you have to just watch the symptoms with deglycerized licorice. Recovery time is typically 4 to 6 weeks for the overturn of that epithelium to heal itself. When we come back, we'll talk about the small intestine.